G'day everyone, this is Health Highlights, a show about health professionals and the people and the stories behind the names we hear about, but we seldom get to meet. Now when it comes to your health, you can go without food for 40 days. You can go without water for 3 days. But when it comes to breathing, you can only not breathe for 3 minutes and you tend to pass into the next world. So it's really important around breath and actually how we breathe. But I don't know if you've considered that chronically bad breathing is actually really bad for your health. And so today we wanted to delve into what that looks like. And we have one of Australia's leading breathing therapists with us, Dean O'Rourke. How are you, Dean?
Nice to meet you again, Simon.
Oh, it's good to be here. We're here, of course, out of tune. Dean works with us, so it's great to be able to have him on the show. So Dean, can you tell us a little bit about your training and where that came from?
Yeah, well, I trained in what is known as the Buteyko breathing method back in 2008. And that forms the foundation of breathing therapy. It's a wonderful therapy, and I've done a number of things since that in training in my field and continue to do so. So yeah, it's been a long process. It's been 10 years now that I've been in clinical practice.
So can you tell us, because I know that there's a bit of a story and there's certainly a bit of a passion behind why you're doing what you're doing. So can you just briefly tell us the story behind that?
Yeah, so what happened was in my late 20s, early 30s, just out of the blue, I started suffering from hay fever, and it very quickly became chronic, constant and severe, and I was taking every medication I was given. I was taking nasal sprays, antihistamines, and I was getting sicker and sicker despite trying to do everything that I needed to. And in desperation, I went looking for an answer to try and see if I could get some relief of these horrific symptoms. It was all year round, not just in spring. And in my search, I came across breathing function and started changing my habits, made some simple dietary changes as well. And within a number of weeks, a few short weeks, my symptoms had disappeared. And I've been basically symptom-free and medication-free ever since.
Wonderful. So then, what was the impetus behind turning your health experience actually into your now profession as a breathing therapist?
Yeah, well, good question. What happened was when I got that kind of result, I was so excited by it that I thought, why not see if I can help others that suffer from the same sorts of things? And I had the perfect vehicle to pursue a career through Attune Health Centres. So when the opportunity came up to start to help people in this way, I just grabbed it with both hands.
And I mean, you're the only breathing therapist in the whole of the Hunter. So there's not many of you around, but it certainly is a powerful thing to do. So why is it important that we actually breathe effectively?
Yeah, bottom line is that breathing, your breathing function, forms the foundation of your health.
Yep.
And if it is functional, it'll set off a chain reaction, so to speak, through the body that is a positive one that will promote health long term, both short and long term. But if your breathing is dysfunctional, particularly if it starts moving from mild into moderate to more severe levels, then it's going to set off a chain reaction of some degree that will be damaging to your health. So that's why breathing function is so critical.
And so the question that we often get asked is, okay, how do you actually develop a poor breathing habit? Is there particular things that we're doing in our culture or in our lifestyle that result in us having poor breathing? Yeah,
look, it can be many different factors that can lead to a breathing dysfunction. It can go right back to basically into the womb. If someone was thumb sucking, used a dummy a lot, was bottle fed rather than breastfed, they can be factors very early on. Other things like physical trauma or emotional trauma can also be a factor. It tends to run in families, so I think children can learn bad breathing habits from unsuspecting parents. And the other thing is our lifestyles have changed so much. A lot of people these days, we're sitting a lot in poor postured positions, a lot of screen use. These things I think can have a big impact on our breathing habits.
And so we're talking about poor breathing versus good breathing.
Yeah.
So can you show us or compare the difference? So what actually is bad breathing?
Yeah, all right. So in terms of optimally functional breathing, The study that I worked on with Dr. Mark Russo and Danielle Santorelli at the Hunter Pain Clinic, we found that optimal function in breathing is breathing nose to diaphragm on a constant basis, slowly, around about 6 breaths a minute being optimal at rest for adults. So dysfunctional breathing is moving away from that habit. So if a person starts to develop too much mouth breathing, if they start to shorten their breathing up to sort of this position here, they get an upper chest breathing pattern, breathing through the mouth, breathing speed tends to increase. Those are sort of the classic signs that someone's moving into dysfunction, and then it can be a progression over time.
So what sort of health symptoms am I going to have if I'm breathing poorly? So is it, obviously you had hay fever and nasal things, but I'm sure there's a range of other conditions that people will have if they breathe poorly.
Yeah, it's an interesting area, that one. The bottom line is, if you have a breathing dysfunction, it really comes down to genetic predisposition as to what you're going to suffer linked to that dysfunction. So the next 100 people that come through my door, one group will have asthma, another group will have hay fever, another group might have recurrent respiratory infections, another group might have anxiety or panic attacks or sleep disordered breathing as it's referred to. So it can be any number of problems that can be linked to breathing dysfunction. The dysfunction might not be the cause, sometimes it is, sometimes it isn't, but it can certainly amplify symptoms.
And so you talk about sleep. So what are some of the things, because I know there's a lot of people who have poor sleep and actually don't get good restful sleep.
Yeah.
What particular conditions are you able to support or help with actually helping them with the breathing?
Yeah, well, what we've found here at the clinic is that a lot of people that are coming with medically diagnosed sleep disorder breathing, such as snoring or obstructive sleep apnea, what we're finding is that they actually have a breathing problem whilst they're awake. Their breathing is not functional day or night. And what we're finding is we address their daytime breathing habits. It seems to have a positive impact on what's happening when they're asleep, probably because breathing is basically automatic day and night.
Yes, wonderful. And so those who are out there, we have an integrated sleep centre here, don't we, that actually helps with sleep hygiene and helping you breathe more proficiently during the day, and the amazing results we're seeing with people actually getting better night's sleep, which is really exciting to see, isn't it?
It certainly is.
And the flow-on effect of other health benefits from getting your breathing effective is really limitless, isn't it, in a way?
Well, breathing's foundational.
It is.
It's foundational.
So we actually did a test on me. As you saw, I had the machine on. So can you quickly, Dean, tell us, what was this machine that I just had plugged in just before?
So this is a biofeedback system. It's known as capnometry. It measures a few key areas of breathing. We measure the breathing rate, how fast the person's breathing. We're measuring their carbon dioxide and tidal CO2 reading, which is very important. CO2 is a very important gas that the body needs. It's not just a waste gas. We also get to look at the breathing pattern to see if there's any disruptions in the breathing pattern as well. And it gives us an indicator of how that diaphragm's functioning, which is a very critical aspect as well.
And so I did a test, and there was actually a few different sections that we did through that test. Can you explain? So when I came in and you did the test, there was actually about 3 different things that you got me to do.
Yeah.
Can you just briefly explain them? And we're going to put up on the screen in a second my actual breathing test, so you can see how the assessment works.
Yeah. Okay, so when you came in and we started the assessment, we wanted to get a baseline reading. So what we're looking at is what Simon's breathing like when he's just seated and relaxed. So we just see what sort of breathing speed he has at that point, what his carbon dioxide levels are at that point, whether the pattern is stable or has any disruptions in it. After that baseline reading's taken, it takes a couple of minutes to get that. Then we give you a little mild stress test. So get you to do the little spell the words backwards test. And what we're doing there is to see what impact stress is having on your breathing pattern.
And so what section was section 2?
Section 3.
Oh, section 3 was it? Yep.
Yeah, because your baseline, there was actually 2 sections in your baseline. Yes. One where I think you were very conscious of needing to breathe slowly.
Yes.
Then your breathing pattern started to go into what it does normally.
Yes.
Then we had the stress test for section 3.
You can see that there.
And then
Yes.
section 4 was when we laid you down and got that supine reading.
Okay, and so then now we want to compare my assessment with someone who has a really bad breathing problem. So Dean, can you describe this person just briefly?
Yep. So the person we've got here with this breathing pattern, he came to me about last year sometime, and he is one of the typical sufferers of sleep apnea, and quite severe sleep apnea. Now, he'd been tested overnight, and it was medically proven that he had a serious breathing disruption occurring in his breathing all night long. And when we tested him, obviously he was awake, so I put him through the same testing procedure that we put through Simon through today. And what you can see here, if you have a look at his breathing pattern compared to Simon's, that there's a lot more disruptions in that breathing pattern. There's also a lot more breathing occurring in between those breathing disruptions. So fast breathing oscillated with breathing stopping. So a very messy breathing pattern is clearly seen there. You can see the large gaps there are between the breath and the bottom of the graph. That's an indicator that the diaphragm's really struggling to operate. So it's clearly showing that this particular individual not only had a breathing problem when he was asleep, but he had a serious breathing problem whilst awake.
And I found it really interesting when he's lying down in the supine area over there, there's a couple of apneas there.
Absolutely.
Which is very much what he gets at night, isn't it?
Indeed.
So look, that's really fascinating information. So Dean, can you tell us what would your top 5 tips be around staying healthy and having good breathing?
Yeah. In modern life, it's not easy. But I would say make relaxation a high priority.
Yep.
Try to do something every day that does relax you. Another thing I would recommend is try and minimise sitting and screen time as much as possible. So making sure you're moving your body as much as you can each day and minimising time on screens. Postural awareness, being very aware of how you're sitting, standing, walking. Posture can have such a big impact on breathing function. Absolutely essential that you develop a nasal breathing habit rather than a mouth one, and a lot of people need help with that. So lastly, I would just say that if you feel as though you do have a functional problem, it's a wise choice to get it checked out.
And so how do you get your bad breathing actually corrected? So what would happen particularly with you, and is it a permanent change, or is it something that...
Good question.
How does that work?
So if someone comes in for their assessment, normal assessment takes around 45 minutes, and what we're doing there is determining whether or not they need our help, and if they do, then there's a number of pathways that can be taken to give them the help that they need. It's a simple step-by-step process of daily work to bring about functional change, replacing some old habits with some new ones. It's very simple to follow. Where the challenge comes in is changing your habits whilst continuing to go through your life. So we provide very comprehensive support to people to help them make those habit changes. And normally within a few weeks, their breathing pattern has changed quite dramatically, and they're often feeling better very quickly.
Wonderful. Yeah. Well, look, wonderful information. Thank you, Dean, so much for coming in and sharing your incredible knowledge around that whole area of breathing. I really hope that you found that very interesting. And if you want to find any more information about Dean, about the Integrated Sleep Centre, or anything more about the breathing therapy that we have here at Attune, you can see all the information that will be on the screen for you right now. Look, thank you so much for joining us, and thank you, Dean, for sharing your time.
Thanks for having me.
We look forward to seeing you at the same time, 12:30 next week. We're going to have another incredible interview for you. Remember, healing is a gift, health a responsibility. Have a fabulous week. See you later.
Thank you.